Hi everyone, I'm Lois Skillings and I'm the president of Midcoast Parkview Health. And we thought it would be helpful for us to share with you some of the activities that we have been doing over the past several months to both prepare for and respond to the COVID-19 pandemic here in our Midcoast, Maine community. I'd like to start by talking about the timeline of some of the activities that have happened here at your local hospital and health system, so that you're aware of the preparation work done and the outstanding team that's here to care for you should the need arise. So when we first started hearing about this global pandemic in early March, we began to pull together our own internal response system and emergency preparedness team to get ready for what we knew was coming from hearing the reports that were happening across the world and across the country. And so we followed very closely both the national and state CDC guidelines throughout this pandemic so that we're sure that we're as up to date as we can be. One of the things that's so important for all of us to recognize about this pandemic is that this is a new disease. It's a novel virus that none of us in healthcare have had experience managing before. So all that's happening across the world and across the country and in our state, we're sharing and learning together how to best prevent the disease from spreading and how to treat people who do contract the virus. So in early March, we had our first confirmed case here in Maine on March 13th, and then by March 19th here at Midcoast Hospital, we started receiving patients who had positive COVID-19 disease. And as we prepared for that, we also realized throughout the state that it was very important for us to stop then elective surgeries and to restrict visitors so that we were really minimizing the risk of spread internally to the organization and within the community. Also in April, early April, thanks to a national article by Dr. Atul Gawande that was published in the New Yorker, health systems around the country began recommending universal masking to prevent the spread of the disease to healthcare workers and from patients to healthcare workers and healthcare workers to patients in the public at large. So this universal masking was adopted here at Midcoast in early April 7th. And we really feel that as we've seen this evolve around our state and the country, that this universal masking has made a very big difference in controlling the spread of this disease. Then in early May, as the state began reopening certain vital services, our healthcare system began providing time-sensitive care for people who may have been putting off some of their needed surgeries or trips to the doctor's office or consultation visits, and that began in early May. And then in early June, we actually started universal testing of all inpatients and also anyone who was coming in for a procedure or a surgery. So these are the kind of things that we have done early on and continue to do to stand ready to provide these care and services. Early on, Midcoast Hospital was designated as a critical care facility here in this region of Maine because of the capacity that we have with intensive care beds and equipment. We also expanded many negative pressure rooms to ensure that we had the capacity to take care of increased numbers of COVID-19 patients. We reconfigured our ambulatory office environment in doctor's offices so that we could separate people with respiratory illness from people who did not have respiratory illness to, again, decrease the potential risk of transmission from patients to patients. One of the most amazing things that have happened throughout this pandemic is that we began to launch telehealth visits where, from the comfort of your own home, our providers, our doctors and advanced practice professionals could have a visit with you through your computer or your iPad or your phone to be able to keep up to date on important healthcare situations that you may be receiving, including even at our walk-in clinic. And telehealth has really exploded around our community as well as in the state and our country as we are beginning to learn to use this technology more and more to help people to be cared for without having to come into the office. We also did a lot of redeployment of doctors and nurses and respiratory therapists to retrain them who had not maybe worked in critical care for a while or emergency medicine for a while, to retrain those skills to navigate an increased surge of patients beyond that which we're normally used to. This was because we were seeing what was happening in Boston and New York and in other parts of the country, where hospitals were frankly overwhelmed with the numbers of patients that they needed to care for. So proactively, we did that training, got our staff ready, and I'm just so proud of the doctors and nurses who stepped up to say, I'm prepared to go back to learn this skill and make sure that I'm available if my community needs me to provide this kind of care in my own health system. We also were very fortunate, if you remember, Midcoast Parkview Health merged with Maine Health on the 1st of March. And now being part of the Maine Health system, we have the power of their supply chain. Very early on in this pandemic, hospitals around the country realizing that the supply chain interruption, especially from China, of things like masks, N95 masks, and other personal protective equipment was interrupted. So being part of Maine Health, using the power of their supply chain, we've been very fortunate here that we have not had critical shortages of personal protective equipment throughout this pandemic. And we feel very blessed to have that kind of support from Maine Health. Another great project that happened with the ingenuity and entrepreneurship of the Brunswick Fire Department and also Bowdoin College professor Dr. Dale Cyphers, a physics professor at Bowdoin, partnered with Midcoast and then Maine Medical Center and Maine Health to develop a reprocessing procedure for actually re-sterilizing and reprocessing N95 masks and keeping them in reserve in case critical shortages would happen in the future. This is an example of how a local partnership happened just like this, very quickly, of people seeing a need and coming together to solve a problem, and to see people working together like that, it was just a very special thing. And we've been very fortunate. We have not had to use reprocessed masks, but again, other parts of the country and world were experiencing such great shortages. We didn't want to wait and hope to see if we would have a shortage. We wanted to make sure that we would be prepared in case that were to happen. I would also like to just tell you all the outpouring of support from the community has been tremendous to our staff. If any of you had the opportunity to drive down the driveway of the hospital here on Medical Center Drive, you'll see homemade signs and professional signs that people just spontaneously put there overnight to bring our staff encouragement and support, and to know that the community was behind them, and just so grateful for the outpouring of support from the community to our staff at the front line. It's been tremendous. We also worked very closely with our local EMS system, recognizing that fire and rescue and the police department, those other first responders, are really part of our team as well, and that we need to make sure that they have the equipment and supplies and support that they need as well. We also partnered very quickly with our long-term care facilities and assisted living facilities in the community, recognizing that throughout the country, the outbreaks that occur in these kinds of congregate living facilities can be very devastating, with high mortality rates for the residents in long-term care. So our team of Randy Reynolds and Dr. Carl DeMars began very quickly to meet every week with our local long-term care facilities in this whole region to talk about what is the best protocol and what are we learning from Maine Health and from Maine CDC, and how can we work together to keep our seniors safe in our community. We also have been providing weekly updates and emails through our website and social media to our community to keep people informed, because that's really so important. So we'd now like to make sure that everybody knows, I'm sure you see this a lot on the news and in other venues, that the symptoms of COVID-19 infection, and for many people who have this infection, they may not have any symptoms at all or have a very mild case. For others, it can be more severe. And there's often an asymptomatic period where the person could have COVID-19 infection but not be exhibiting any symptoms. But the normal symptoms that people are seeing is things like fever, cough, and chills, a loss of taste and smell that is new, a new loss of taste or smell, shortness of breath, severe shortness of breath sometimes, muscle aches, and sore throat. These are the symptoms to watch out for in case you feel that you may have been exposed to COVID-19. And if you are experiencing any of these symptoms, we really encourage you to reach out to your primary care provider, or to contact our walk-in clinic as well, or our emergency department, especially if you're having severe symptoms of shortness of breath. The treatment options for COVID-19 are largely supportive, meaning fluids and rest, and taking care to have the rest that you need, and drink plenty of fluids and the normal things that you would do with any kind of virus. At the same time, sometimes supportive care isn't enough, and if increasing shortness of breath should occur, it's really important for you to seek help and to contact your primary care provider or to seek emergency care. Here in the hospital, we have been providing care for people who are severely ill and have needed to be on a respirator. We've also included a medication that we're part of a study with Maine Medical Center called remdesivir. That's an antiviral agent that has shown some promise in providing support and care for people with COVID-19. And also we have had some success here because we're also part of a trial using convalescent plasma, which is also a trial with Maine Medical Center in the American Red Cross. So both of these treatments are being used here locally at your local hospital with success. So the situation overview, we've administered thousands of tests here. We have a 2% incident rate. Today, I'm speaking to you, it's the middle of June, and since the very beginning of this disease, we have had 35 people here in our community through our hospital who have tested positive. We've had 15 inpatients who have had their care here at Midcoast Hospital. We've really seen in Maine that flattening of the curve and the number of incidents of cases coming down here in Maine. What's important for us all to know, though, that this pandemic, all of the expert infectious disease and epidemiology and public health physicians and other practitioners around the country and the world who have been studying this recognize that this virus is still there in our community, and it's there in our state and there in our country and in the world, and that we need to continue to be cautious to ensure that we are doing everything we can to slow the spread of this, to prevent especially the most vulnerable in our community, people who are elderly, people who have other illnesses that make them at higher risk if they do contract this virus. It's very important for us to stay vigilant. Cumberland County early on has had the largest impact here in Maine because of the density of our population, followed by York County, and it is very much a positive sign that the curve is flattening, and that's most likely due to our aggressive stance here to have universal masking and to provide that physical distancing and to avoid large groups and gatherings. So I'd like to share with you the financial impact. Many people have asked this question because, as you know, this has had a devastating impact on our local economy, and it's really challenging to see how this has affected people's livelihoods and their jobs and the unemployment rate. Here at Midcoast Hospital, we anticipate by the end of this year, even with some federal relief that we've had, to still have a $50 million loss by the end of this calendar year. That's unlike anything we've ever experienced here. I've certainly never seen this in my career, to see this kind of the scale of loss that we're experiencing. We're very fortunate here at Midcoast that we had very strong reserves going into this crisis, and that we are also part of the Maine health system, which also has strong reserves. Because of that position, we made the decision to support our employees and to keep people employed even when we didn't have work for them, and to have them either work at home or come in to help us in other roles and jobs, so that we could keep our local, our employees whole during this pandemic, because we realize as we're coming out of this pandemic, we can't do this work without our staff. It's really our employees who fulfill our mission, and so taking care of them in this time of need was something that felt to be an important value of Maine Health and a value of Midcoast Parkview Health. So looking forward, again, we remain in the midst of a pandemic that could flare up at any time, and that we're likely to see COVID-19 patients here in your local community and at your local hospital for many months to come. We never stopped emergency care, and it's been a very busy place right through this pandemic, taking care of many people who don't have COVID-19 as well, because babies keep being born and heart attacks sadly happen, and other kinds of emergencies happen. So we've been right here throughout this providing care and emergency services. At the same time, as I mentioned, in early May, we began opening for time-sensitive care. People who may have put off diagnostic testing or trips to their doctor's office or specialty offices because of concern. of the spread of disease, but we're open for those care and services now, and even providing some preventative care and some elective care at this point, because we recognize that things like having your annual mammogram or your colonoscopy, these are important things for our health in order to prevent diseases that from happening and to keep us healthy and well. And in order to ensure the community that we are ready to do this in a safe way, that you have safe care here, is that we are providing things like universal masking for all of our employees. And we've been doing this since early April. So everybody who comes into our buildings or to any of our facilities is wearing a surgical mask. We also do a daily screening of all care team members. Every single employee has an app on their phone where they go on and answer questions to make sure that we don't have any of the symptoms and that all the screening criteria so that we're safe to come to work. And we track and trend this so that we're sure that our employees are also safe who are coming into work. We're testing all patients who are scheduled for inpatient and outpatient procedures. The reason for this is that, as I said earlier, there are many asymptomatic patients who have COVID disease, and it's been found, even though we only have a few months of experience throughout the country and the world, it's been found that for people who have COVID-19, even if they're asymptomatic, if they do have general surgery, that they don't do as well post-operatively. So it's important for us to make sure that people who are having surgery do not have COVID-19. We also have non-COVID-19 areas in all of our facilities so that we can separate people who are symptomatic from those who aren't. Again, the availability of telehealth visits throughout our Midcoast Medical Group provider offices, as well as our walk-in clinic. And we have an online check-in service for laboratory services and walk-in care so that you can call ahead and make an appointment so that you are in and out and don't have to wait in line, kind of thing. So that's very important. So the future. What are we seeing is the key steps to ensure continued safety: physical distancing, not gathering in large groups, wearing a mask, meticulous hand hygiene. I will tell you, I probably wash my hands more than 12 times a day, and it is so important. And to stay safe at home when we can. And to avoid overwhelming the healthcare system is a big part of this. And I think that we've recognized now that the work that's happened here in Maine has been very successful. And we did not see what happened in New York and Boston. And we're all very grateful to the community for their support in making that happen. And the significant risk continues, though. That's an important thing to recognize, especially with our senior living facilities in the region. So the key takeaways today, first, is that this is a novel virus. It's brand new. We are learning about this as it goes along. There's things that we thought 2 months ago that we now don't think anymore, and things that we'll think tomorrow that we didn't know today, because it is a new disease. And most diseases, healthcare professionals have had literally centuries of research for some diseases to understand how they spread and how to prevent them and how to take care of somebody who has that disease. And this is new, and so we're learning as we go along. The other key takeaway I want you to know is that your community healthcare system is prepared. We are here for you. We are ready to take care of all of your healthcare needs safely, as well as if you have COVID-19 and need our help, we are here for you. It is safe to resume your care and healthcare services if you need it, and that we're in this to win this together. The staff at Midcoast Parkview Health have been phenomenal throughout this issue. It's been amazing to see our frontline staff who just show up every day to do the great work that they do, caring with such compassion and dedication and knowledge and skill to do their very best. And that never wavered throughout the past several months as we've been fighting this fight together. We'd also like to share with you a message today that we know how hard this is. This is so hard on everyone in our community. The feelings of isolation, the fear, the anxiety, the disruption of our daily lives, the things that we hold near and dear. There's so much uncertainty. So I would just ask you all to just take care of yourselves and to reach out to help one another. And that's one of the things people ask me all the time too. What can we do for the local hospital? What support can we provide to our local caregivers? And I would say that same message, to take care of yourself and to take care of one another, to ensure that you're doing the physical distancing, to avoid large gatherings, to wear your mask when you're out in public, and to wash your hands. Those are the things that you can do mostly that will make the biggest difference to get through this together, and to try to incorporate these new things into our daily lives. And mostly to thank you for all that you do every day to support your local health system, because you know that we're here when you need us. We've always been here and we'll continue to be here in the future, and we hope that you can take good care.